Thank you for listening to Depictions Media Radio.
Cover this morning, so let's get right into it. I'll begin with vaccines. This morning, I visited the vaccination clinic at the Nepean Sportsplex here in Ottawa. It was great to see more and more people getting vaccinated. People are in a good mood. A lot of folks were there with their elderly parents. Everyone was chatty and focused, but quite frankly, it was the amazing volunteers who were working so hard who really encouraged us all, and we saw smiles on everyone's faces. I also had the chance to chat with a few of the many healthcare workers who are part of this vaccination effort. They're all doing an incredible job during this really tough time. My job as a politician is usually go around shaking hands, so that wasn't the challenge that we got to do. There was a number of older folks who I needed to remind that an elbow bump is the way we do it. But we're all figuring out how to navigate through this, and the fact that so many people are getting vaccinated is a really good thing. Our frontline workers have given up a lot to stay safe. Last week, I spoke to nurses from the Victoria General Hospital in Winnipeg. They shared what this past year has been like, caring for isolated patients in serious situations, sometimes being their only point of contact, and holding an iPad or holding their hands through a window while family members watch through a window. It was incredibly difficult, incredibly challenging for healthcare workers across the country, even more so when it comes to the fears that on returning home, they might be bringing home this disease to their families. It's been incredibly stressful, but they continue to step up every single day, and all of us need to make sure we're doing the best we can to keep them from getting overwhelmed and overloaded with new cases. But everything they do makes them the heroes of this pandemic. Présentement, notre plus grande priorité est de faire en sorte que le plus de Canadiens possible puissent être vaccinés le plus rapidement possible. Et on travaille sans relâche pour y arriver. À ce jour, on a livré plus de 6 millions de doses de vaccins aux provinces et aux territoires. Cette semaine, on va recevoir nos plus importantes livraisons jusqu'à maintenant avec 3,2 millions de doses. Ça inclut les livraisons prévues de Pfizer et de Moderna, ainsi que les 1,5 millions de doses du vaccin AstraZeneca qu'on va recevoir aujourd'hui de la part des États-Unis. As we've been saying for months, and as we've been planning with the provinces and territories since last year, the end of March will be followed by an increase in vaccine supply. We now have handily exceeded our promised target of 6 million doses delivered before April. And this week, we begin our ramp-up phase. Throughout April and May, 1 million doses a week are scheduled to arrive from Pfizer alone, plus Moderna, plus AstraZeneca. And for June, we have good news to share this morning. Pfizer has now confirmed that they will be moving up 5 million doses from later in the summer into June. That'll bring our total from 4.6 million to 9.6 million doses for that month alone. Of course, that's in addition to the other doses of the Moderna and AstraZeneca vaccines that we'll also get. A lot of doses being delivered means a lot of people who are able to get their shot. If you haven't had your vaccine already, it might be your turn or a family member's turn soon. If you want to learn more about vaccine safety and effectiveness, there'll be a Facebook Live event tomorrow where Dr. Tam, Dr. Njoo, and other experts will answer Canadians' questions directly. To attend or get more information, go to the Healthy Canadians Facebook page. Today, I also want to talk about where we are with the virus and what that means going forward. In some places, cases of COVID-19 are holding steady or even going down. And especially in long-term care homes, vaccination seems to be making a real difference in protecting people from outbreaks. That said, hospitalizations from COVID-19 remain high, and case numbers are going up in many regions here in Canada and around the world. Variants of concern, which can spread more easily and make people even sicker, are increasing quickly. In BC, where the number of cases had been under control, they're now having to put in place new restrictions for the next 3 weeks. I want to extend my full support to Premier Horgan and to all premiers across the country as they make tough decisions to keep people safe. As we have since day one, the federal government will have their backs and do whatever it takes to save lives, to protect our frontline workers, and to support jobs and businesses until we get through this. Il ne reste que quelques jours avant le début de la fin de semaine de Pâques. Et la Pâques juive a commencé samedi dernier. C'est maintenant la 2e année de suite que ces célébrations se déroulent en temps de pandémie. Malheureusement, ça veut dire qu'il faut continuer de faire bien attention. Dans la dernière année, on a vu les cas augmenter après d'autres congés, comme celui de l'Action de grâce ou après Noël. C'est très important d'éviter une augmentation après Pâques si on veut continuer le printemps dans la meilleure position possible. Je sais que c'est décevant, mais il faut éviter les rassemblements. C'est pas le temps de voyager. Continuez de porter votre masque, de vous laver les mains et d'utiliser l'application Alerte COVID. La vaccination de masse progresse bien, le beau temps s'en vient, mais il faut continuer nos efforts un peu plus longtemps. Avec la hausse récente des cas dans certaines régions et les nouveaux variants, on ne peut pas baisser nos gardes. Alors qu'on continue nos efforts pour protéger les Canadiens, il ne faut pas perdre de vue que la pandémie a accentué les inégalités à travers le monde et a eu un impact plus marqué sur les populations vulnérables. À ce sujet, hier, avec le secrétaire général des Nations Unies, Antonio Guterres, le premier ministre de la Jamaïque, Andrew Holness, et plusieurs dirigeants mondiaux, on a tenu une 3e rencontre sur le financement du développement. On a discuté de solutions concrètes pour aider les pays les plus gravement touchés par la crise économique actuelle, notamment en ce qui a trait au surendettement et à l'aide internationale. Il faut adapter nos systèmes économiques afin qu'ils répondent aux enjeux mondiaux urgents tels que la pauvreté extrême, les inégalités et bien sûr les changements climatiques. Le Canada est toujours là pour écouter et pour agir. Et on va certainement soulever ces questions lors de nos prochaines discussions avec le FMI, la Banque mondiale, ainsi que le G20 et le G7. As we rebuild from this pandemic, we have to make sure no one gets left behind. Yesterday, Ministers McKenna and Monsef announced $250 million for transit in rural and remote communities. This fund is part of the unprecedented public transit investment we announced last month, and it is the first federal fund dedicated to rural transit. This is part of our job to create jobs and fight climate change. It's also about building more inclusive communities where seniors can get to their doctor's appointments and where people of every age can get the services they need. Before I end today, I want to say a few words about Easter and Passover. Again this year, we won't have the kinds of celebrations we were all hoping for because we just can't afford to let our guard down. I know I've said the same thing before every major holiday over the past year, but this time, what's different is that even if the end of the pandemic is in sight, the variants mean the situation is even more serious. We're entering the final stretch of this crisis. We just need to stay strong a little longer. More and more vaccine doses are coming every week, so there's reason to be hopeful. So please, keep yourself and your loved ones safe. Now is not the time to travel. Avoid gatherings and parties, and continue to keep your distance. I know it's not easy, but together we will get through this. Merci. Je suis maintenant heureux de passer la parole à la ministre Anand. Anita.
Good morning, and thank you for joining us today. By the end of this week, Canada will have received approximately 9.5 million doses of approved vaccines from 3 manufacturers, Pfizer, Moderna, and AstraZeneca. This is well ahead of the 6 million doses that we had originally projected for the first quarter of this year, with 3.2 million doses arriving this week. The work to accelerate the delivery of doses continues every day. Comme le Premier ministre vient de l'annoncer, Pfizer-BioNTech accélère encore une fois les livraisons au Canada avec l'arrivée de 5 millions de doses supplémentaires en juin. Le Canada recevra au moins 1 million de doses du vaccin de Pfizer-BioNTech chaque semaine d'ici la fin du mois de mai. Et en juin, ce sera 2 millions de doses par semaine, chaque semaine. As the Prime Minister just announced, Pfizer-BioNTech is again accelerating deliveries to Canada, with an additional 5 million doses arriving in June. Canada will receive at least 1 million doses of the Pfizer-BioNTech vaccine every week from now until the end of May, and in June, that will be 2 million doses a week every week. Canada was among the very first countries in the world to sign a deal with Pfizer, and we have worked constructively with the company and all suppliers in order to ensure a stable supply of vaccines for our country. Originally, we had contemplated approximately 8 million Pfizer doses in the second quarter alone. And now, due to successive negotiations with the company, we are set to receive close to 18 million doses of Pfizer by the end of June. This means millions more additional doses available to be administered to Canadians by the first days of summer. We said that when vaccines were ready, Canada would be ready, and we are, with a diversified portfolio of vaccines. This is why, in addition to the accelerated Pfizer doses, 1.5 million doses of AstraZeneca's vaccine were loaded onto trucks this morning in the United States and are en route to Canada as we speak. We also expect 4.4 million additional doses of AstraZeneca before the end of June. Combined across the currently approved vaccines, Canada is now on track to receive at least 44 million doses of vaccine by the end of June, and very well on the way to having more than enough to ensure that every Canadian who wishes to be vaccinated can be fully vaccinated by the end of the summer. Bien qu'il s'agisse d'une excellente nouvelle, cela ne signifie pas que notre gouvernement ralentit ses efforts pour accélérer la livraison de doses chaque fois que cela est possible. Et nous poursuivons notre travail, tout comme chaque Canadien et Canadienne, de rester vigilante et de continuer à suivre les consignes de santé publique. The Government of Canada will continue to bring vaccines into this country while managing the inherent volatility in global supply chains for this product. We will see through this challenge together. Merci beaucoup, Megwetch. Thank you.
And we'll turn it over to Dr. Tam.
Bonjour à toutes et à tous. Today we'll touch on the recent safety signal associated with the use of the AstraZeneca vaccine in adults under 55 years of age. But first, we'll begin with an update on the current numbers and trends. COVID-19 activity has been steadily increasing for several weeks, with a rising number and proportion of more contagious variants driving epidemic growth in many areas. To date, over 970,000 cases of COVID-19, including 22,900 deaths, have been reported across Canada. Over the past week, there have been an average of over 4,600 new cases and 26 deaths reported daily. The ongoing increase in infection rates is now playing out in our hospitals, with rising trends in severe and critical illnesses placing renewed strain on the health system. Over the past week, an average of over 2,200 people with COVID-19 were being treated in our hospitals each day, representing a 6% increase over last week. Over 660 of these people were being treated in intensive care units, which is 14% higher than last week. Most concerning is the continued increase in number and proportion of variants of concern that spread more easily and increase the risk of severe illness outcomes. Over the past week, there has been a 64% increase in new variant cases. To date, over 9,000 variants of concern cases have been reported across Canada, with the B117 variant accounting for over 90%. New variant case numbers represent the tip of the iceberg, as there are thousands more cases that have screened positive for problematic mutations. Yesterday, Health Canada issued a statement in relation to new data on additional cases of a rare type of blood clot known as vaccine-induced prothrombotic immune thrombocytopenia, or VIPIT, which occurred following the administration of the AstraZeneca vaccine in several European countries. To date, no cases of VIPIT has been reported in Canada. Nevertheless, as the data on these additional cases could change the risk-benefit assessment, Health Canada, as regulator, has put in place additional terms and conditions on the authorization of AstraZeneca vaccine in Canada. In the interim, Canada's National Advisory Committee on Immunization has recommended to pause the use of AstraZeneca vaccine for people aged under 55 years, pending a full risk assessment by Health Canada. Chief Medical Officers of Health have considered NACI's recommendations and have issued a statement outlining a unified decision to take this precautionary measure. I know that this is another difficult development in the seemingly never-ending twists and turns of this pandemic, but there is a point of grace. I couldn't have said it better, so I would just like to quote Dr. Menaka Pai, Associate Professor of Hematology and Thromboembolism at McMaster University, who notes, strong global vaccine safety surveillance rapidly picked up this rare and serious adverse event. Collegiality, academic rigor, transparency, and medical science will help us manage it. As spring begins, warmer weather and as important religious observations such as Passover, Easter, Vaisakhi, and Ramadan are upon us, we too must do our best and remember our duty to protect one another. COVID-19 activity levels are different depending on where you are in Canada, but there is a risk of introduction and rapid acceleration of cases everywhere. Please continue to follow local public health recommendations, stick to safer ways we've learned to celebrate during COVID-19, and save gatherings for a better time in the future. Despite the hurdles, we are getting closer every day, and we're stronger and more united for it. Thank you.
Bonjour à toutes et à tous. Aujourd'hui, nous allons aborder le récent signal de sécurité associé à l'utilisation du vaccin d'AstraZeneca chez les adultes de moins de 55 ans. Mais tout d'abord, nous allons commencer par faire le point sur les chiffres et les tendances actuelles. La transmission de la COVID-19 est en augmentation constante depuis plusieurs semaines, avec un nombre et une proportion croissante de variants plus contagieux à l'origine de la croissance épidémique dans de nombreuses régions. À ce jour, plus de 970 000 cas de COVID-19, dont 22 900 décès, ont été signalés au Canada. Au cours de la semaine dernière, nous avons enregistré en moyenne plus de 4 600 nouveaux cas et 26 décès par jour. L'augmentation continue des taux d'infection se répercute maintenant dans nos hôpitaux, avec une tendance à l'augmentation des maladies graves et critiques et une nouvelle pression sur le système de santé. Au cours de la dernière semaine, une moyenne de 2200 personnes atteintes de la COVID-19 ont été traitées dans nos hôpitaux chaque jour, soit une augmentation de 6% par rapport à la semaine précédente. Plus de 660 de ces personnes ont été traitées dans des unités de soins intensifs, ce qui représente une augmentation de 14% par rapport à la semaine précédente. Le plus inquiétant est l'augmentation continue du nombre et de la proportion de variants préoccupants qui se propagent plus facilement et augmentent le risque d'apparition des maladies graves. Au cours de la dernière semaine, nous avons enregistré une augmentation de 64% des nouveaux cas de variants, avec plus de 9000 cas de variants préoccupants signalés à ce jour au Canada. Le variant B117 représentant plus de 90% des cas. Le nombre de cas de nouveaux variants ne représente que la pointe de l'iceberg, car des milliers d'autres cas ont été dépistés positifs pour des mutations problématiques. Hier, Santé Canada a publié une déclaration concernant de nouvelles données sur des cas supplémentaires d'un type rare de caillots sanguins, connu sous le nom de thrombocytopénie immunitaire prothrombotique induite par un vaccin, ou TPIV, survenu après l'administration de vaccins contre la COVID-19 d'AstraZeneca dans plusieurs pays européens. À ce jour, aucun cas de TPIV n'a été signalé au Canada. Néanmoins, comme les données sur ces cas supplémentaires pourraient modifier l'évaluation sur le rapport entre les risques et les avantages, Santé Canada, en tant qu'organisme de réglementation, a imposé des conditions supplémentaires pour l'autorisation des vaccins d'AstraZeneca au Canada. Entre-temps, le Comité consultatif national de l'immunisation, CCNI, du Canada a recommandé de suspendre l'utilisation du vaccin d'AstraZeneca chez les personnes âgées de moins de 55 ans, en attendant une évaluation complète des risques par Santé Canada. Les médecins hygiénistes en chef ont examiné les recommandations du CCNI et ont publié une déclaration décrivant la décision unifiée de prendre cette mesure de précaution. Nous savons qu'il s'agit d'un autre changement difficile dans le rebondissement apparemment sans fin de cette pandémie, mais il y a un point de grâce. Nous n'aurions pas pu mieux dire alors que nous aimerions citer la Dr. Menaka Pai, professeur agrégé de dématologie et de thromboembolie à l'Université McMaster, qui a déclaré la surveillance rigoureuse de l'innocuité des vaccins à l'échelle mondiale a permis de détecter rapidement cet effet secondaire rare et grave. La collégialité, la rigueur théorique, la transparence et la science médicale nous aideront à le gérer. Alors qu'il fait plus chaud au printemps et que d'importantes pratiques religieuses comme la Pâque juive, Pâques, le Shaki et le Ramadan sont à nos portes, nous devons nous aussi faire de notre mieux et nous rappeler notre devoir de nous protéger les uns les autres. Les niveaux de transmission de la COVID-19 sont différents selon l'endroit où nous nous trouvons au Canada, mais il existe un risque d'introduction et d'augmentation des cas partout. Veuillez continuer à suivre les recommandations de santé publique locale, à vous en tenir aux méthodes plus sûres que nous avons apprises pour faire la fête pendant la COVID-19 et à garder les rassemblements pour un meilleur moment à l'avenir. Malgré les obstacles, nous nous rapprochons chaque jour du but et nous sommes plus forts et plus unis pour cela. Merci.
Thank you, Dr. Njoo. Now we'll turn to questions from media. We'll start on the phone, and after we're done, the ministers and doctors will be available once the Prime Minister leaves after a few questions as well. Operator, over to you.
Thank you. Merci. Première question, Raymond Fillon, TVA. À vous.
Merci. Bonjour, Monsieur le Premier ministre. Vous avez dit lors d'une entrevue la semaine dernière, ça va prendre un petit bout de temps en parlant du moment des prochaines élections. Est-ce dire que si votre budget passe à la Chambre des communes, vous écartez la possibilité de déclencher des élections ce printemps?
Comme j'ai dit depuis les tout débuts, Ray, moi, ma priorité, c'est de passer à travers la COVID et de continuer à assurer un retour économique en force. C'est notre priorité en tant que gouvernement. Évidemment, dans un Parlement minoritaire, on ne sait jamais ce qui va se passer avec les autres partis, mais je l'ai dit très, très souvent, nous avons besoin de se concentrer sur cette pandémie tous ensemble. Nous avons besoin d'avoir un Parlement qui fonctionne. Nous avons besoin de continuer à livrer pour aider les Canadiens et pour faire rebondir notre économie.
compte tenu que la troisième vague bat son plein dans plusieurs provinces, l'Ontario, le Québec, que plusieurs experts qualifient la trajectoire des courbes d'alarmantes, vous avez dit vous-même hier, on n'est pas sorti du bois. Est-ce que ce serait responsable d'avoir des élections ce printemps?
Je pense que faut se rappeler que notre démocratie est forte et on va pouvoir se débrouiller, mais c'est certain que moi, ma préférence, c'est de pouvoir continuer à travailler directement pour les Canadiens, à livrer les mesures d'aide dont les familles ont besoin, d'investir pour appuyer les petites entreprises, pour assurer qu'on est en train aussi de lutter contre les changements climatiques tout en réglant le cours de cette pandémie. Nous avons bien des choses que nous devons faire. En tant que gouvernement, nous restons concentrés là-dessus. Évidemment, ça prend un Parlement qui continue à fonctionner, mais j'ai de l'espoir que c'est la priorité aussi des autres partis de travailler pour les Canadiens et non pour leurs fins politiques.
Merci. Prochaine question.
Thank you. Merci. Next question, Ryan Tumulty, National Post. Line is open.
Yeah, good morning, sir. I'm wondering, with the system that we have now in which Health Canada approves vaccines and then NACI makes recommendations, in this case of the AstraZeneca vaccine, it seems to be showing some confusion and some hesitancy, having Health Canada say a vaccine is safe for all groups, but then having NACI say that it should only be used for people over the age of 55. I'm wondering if you think fundamentally the structure maybe isn't fit for a pandemic, even if it works during normal times.
I think what we saw yesterday, Ryan, was all the different levels of organizations of experts coming together, whether it was public health officials across the country coming out with a coordinated statement, or Health Canada and NACI working together to ensure that there is coordination in the messages. Look, I understand how challenging this can be for Canadians. The science is evolving as we get more and more data. Experts are refining and shifting their recommendations. Canadians need to know that every step of the way, there is one thing driving all these experts, and that is keeping Canadians safe and getting through this pandemic as quickly as possible. That is the underlying element to every recommendation, to every decision that is put out there. And I can tell you that the work that is being done is extraordinary, not just here in Canada, but coordinating with people around the world. The bottom line for Canadians is the right vaccine for you to take is the very first vaccine that you are offered. The more we get Canadians vaccinated quickly and safely, the quicker we'll be able to get back to a semblance of normality. With the variants that are more severe and more transmissible, increasing around the population, we need to make sure we're doing everything we can to get through this.
Follow up, Brian?
Yeah, so just as a follow-up, on the issue of vaccine hesitancy overall, we've seen reports that in some long-term care facilities, only 60 or 70% of the staff are taking the vaccine. Toronto actually had to put a big push to get people into vaccine appointments last week. Are you concerned now that we have this flood of vaccines coming, are you concerned about hesitancy and about not getting people to take them quickly enough to end the pandemic?
I think it's certainly something that is on our mind. We know that the way to get through this is to get as many people as possible vaccinated, and that's certainly our focus. But we're seeing, as I saw this morning at the vaccine clinic here in Nepean, people are positive and enthusiastic about getting vaccinated, and I think people understand that the way to protect us all is for people to get vaccinated. But maybe I'll turn to Dr. Tam for further thoughts on your first question and on the hesitancy question. Theresa.
Yes. On the first question, there are different roles for the different groups, but as the Prime Minister said, we worked lockstep, each playing its role. So Health Canada, being the regulator, triggered a signal to the manufacturer to say, we need more data. We need it to be broken down by age and sex to look for this more serious and rare side effect that is been seen following immunization, even though we haven't seen it yet in Canada. With that, while the data is being gathered, we amass experts from Canada, but also had experts from Germany providing with their first-hand interpretation of what this clotting with low platelets entity is like, and some of the underlying scientific explanations. With that, the National Advisory Committee on Immunization looked into that and said, while we're waiting for this information and more information to come, we've seen enough of the science, but also what we've seen already coming out of the European countries to say, take the precautionary approach. And given the data that we've seen, where most of these rare cases occur in the under 55s, that's the recommendation they have provided to pause offering the AstraZeneca vaccine for this age group for now. And then all the chief medical officers got together, having heard all of this as well, and made a unified position to take this precautionary approach. So that's how that all worked together. But all of it had to be done really quickly. And so I think you've seen that at play yesterday, to take the precautionary approach to keep Canadians as safe as possible while offering a safe and effective vaccine.
Thank you. Next question, operator.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Merci. Bonjour, Monsieur Trudeau. C'est un peu difficile de se retrouver en matière d'approvisionnement. Hier, surtout avec la pause d'AstraZeneca pour les personnes de 55 ans et moins. Aujourd'hui, vous annoncez qu'on va avoir beaucoup plus de doses de Pfizer au mois de juin. Pouvez-vous faire le point sur l'objectif que le gouvernement s'était fixé, c'est-à-dire fin septembre, pour faire vacciner tous les adultes qui le souhaitent? On en est où là-dessus?
Oui, absolument, Mélanie. Comme vous savez, ça fait depuis l'été passé qu'on signe des contrats avec les compagnies de vaccins. Même avant qu'on sache quel vaccin allait être le plus efficace, on s'est assuré d'avoir une gamme de différents vaccins potentiels pour être mieux positionnés. On avait dit, à partir de fin novembre, début décembre de l'année passée, qu'on s'attendait à avoir 6 millions de doses de vaccins au Canada avant la fin du premier trimestre, c'est-à-dire avant la fin mars. Mais nous voilà à la fin mars, et non seulement est-ce qu'on a plus que 6 millions de doses, mais à la fin de cette semaine, on compte avoir plus que 9 millions de doses de livrées au Canada pour pouvoir accélérer le processus. Donc, le travail qu'on est en train de faire depuis des semaines et des semaines pour augmenter le débit d'arrivée des vaccins va continuer. Et c'est d'ailleurs ce qu'on a pu annoncer aujourd'hui, que d'ici la fin mai, on va continuer d'avoir 1 million de doses de Pfizer par semaine, mais au mois de juin, ça va être 2 millions de doses de Pfizer. Tout ça pour dire que arrivé à la fin juin, on parle d'avoir plus que 40 millions de doses de vaccins arrivés au Canada, ce qui nous met en très bonne situation pour dire qu'avant la fin de l'été, tout le monde au Canada va pouvoir être vacciné avec les 2 doses, et même, dépendamment de comment les provinces distribuent ces vaccins, c'est possible que beaucoup de gens aient au moins leur première dose avant que l'été soit vraiment lancé. Alors, on est tout à fait aligné pour atteindre nos objectifs et même les accélérer un petit peu, mais on lâche pas notre travail à tous les jours d'assurer que avec des défis avec différentes compagnies, avec des problèmes de production avec d'autres compagnies, on puisse être confiant que les Canadiens vont s'en sortir le plus rapidement possible.
Un suivi. Juste clarifier, au Québec, M. Trudeau, on a donné une date, le 24 juin. Vous n'en donnez pas. Je comprends que vous dites la fin de l'été, mais la fin de l'été, ça peut être le 20 septembre, comme pour certains, ça peut être le 15 août. Donc, est-ce qu'il y a une date particulière sur laquelle vous avez fait X sur votre calendrier. Puis aussi, par rapport au Pfizer qui arrive plus tôt au mois de juin, je sais que vous ne dévoilez pas les termes contractuels, mais pouvez-vous dire si il a fallu payer une prime pour que les doses arrivent plus tôt?
D'abord, je reconnais que les choses avancent bien au Québec. Je veux souligner d'ailleurs qu'on a tous été très contents de voir le premier ministre Legault se faire vacciner. Ça montre vraiment à quel point les choses vont de bon train au Québec et partout au pays. Par rapport aux dates précises, on a dit depuis le début que tout le monde, tous les adultes allaient avoir leur pleine vaccination, c'est-à-dire 2 doses pour septembre 2021. En même temps, on sait très bien qu'il y a plusieurs provinces qui prennent une stratégie de une dose pour tout le monde plus rapidement, et donc certaines provinces peuvent mettre de l'avant d'autres dates fixes. Nous, notre job, c'est d'assurer l'arrivée du plus grand nombre de vaccins payés par le gouvernement fédéral dans les mains des provinces pour les mettre dans les bras des Canadiens le plus rapidement. Et comme j'ai dit, ça va très bien, mais nous allons continuer de travailler extrêmement fort pour accélérer encore plus. Et je peux tourner vers la ministre Anand pour préciser s'il y a des coûts par rapport à ces 5 millions de doses de Pfizer qui arrivent plus tôt, mais je ne crois pas, mais c'est à elle de répondre.
Merci beaucoup. C'est le même prix par dose pour les 5 millions de doses. Et Premier ministre, vous avez raison. Et toutes les autres choses. Merci.
CBC, is it possible to say at this point what impact these new restrictions on AstraZeneca are going to have on the overall vaccine rollout? And I guess the longer these restrictions stay in place, is that going to compound whatever impact there is?
I'll turn to Minister Anand, but I can say that our portfolio of vaccines was, from the very beginning, as we've seen, extremely heavily weighted towards Moderna and Pfizer. The fact that we are getting 1 million Pfizer doses every single week over the coming weeks, rising to 2 million a week for the month of June. The fact that the target of 6 million doses for Canadians by the end of March, by right now, was based on Pfizer and Moderna alone, means that we are still in very good situation. But of course, we want to get more doses of more varied vaccines, and ensuring the continued delivery of those doses rapidly, including the AstraZeneca doses, to as many Canadians as possible in the coming months, continues to be our priority. Anita, to follow up on that.
Thanks, Prime Minister. Just to build on that, the advice of the Vaccine Task Force, of course, was to procure vaccines from 7 leading vaccine manufacturers, and the minimum amount of doses was 20 million for every 2-shot vaccine and 10 million for J&J. But in addition to that, we exercised options to purchase additional Moderna and Pfizer doses. So, as the Prime Minister said, we are heavily weighted on Moderna and Pfizer as a result of exercising those options. We have 44 million doses of Moderna coming to Canada overall and 40 million doses of Pfizer coming to Canada overall. And as you're aware, 22 million doses of AstraZeneca. So we are continuing to exercise and see the benefits of a diversified portfolio of vaccines. Yes, we are heavily weighted on Moderna and Pfizer at the current time, but what we use as our baseline is the approval of Health Canada. Once a vaccine is approved by Health Canada, it is safe and effective, and from a procurement standpoint, that means all systems are go to bring those vaccines into the country, which is exactly what PSPC does every single day. Thank you.
Glenn McGregor, CTV News. Prime Minister, 2 weeks ago, we had heard reports about blood clotting issues with the AstraZeneca vaccine, yet you came out and assured Canadians that it was safe, and you encouraged them to go get it if it was offered to them. Now we know that there are concerns about this in younger people. Was it a mistake for you to do that? And do you think will that change the way you give advice about vaccines in future? And finally, what would you say to the Canadians who, based on your advice 2 weeks ago, went out and had that AstraZeneca shot?
The advice given by health professionals, the advice that I gave, was that the right vaccine for you is the very first vaccine that is offered. And Health Canada continues to ensure the safety and effectiveness of any vaccine administered in Canada. As we've seen over the past number of weeks, there are different recommendations and limitations given in as the science evolves. But every step of the way, the recommendations that Health Canada makes and that I and other politicians pass along, because none of us are vaccine experts, but we are there to help amplify the messages by Health Canada that vaccines are safe and effective and that everyone needs to get vaccinated with whatever vaccine is offered to them as quickly as possible. But I will turn to Theresa for follow-up on that. OK, avant de passer, écoutez, notre travail en tant que politicien, c'est de passer aux citoyens, de rassurer les citoyens sur les messages des experts et les conclusions des experts. Et ce qu'on dit depuis longtemps demeure la réalité. Le meilleur vaccin pour vous, c'est le premier vaccin qu'on vous offre. On veut s'assurer de vacciner le plus de gens le plus rapidement possible. Et oui, il va continuer d'avoir plus de données, plus de compréhension sur les contre-indications et des effets secondaires possibles. Mais à chaque étape, les experts au Canada et partout dans le monde sont en train de s'assurer de la sécurité de ces vaccins et de la meilleure façon de les livrer aux Canadiens. Ça va continuer d'être notre priorité. Theresa?
Yes, so the advice on any medication or vaccine can evolve over time. And I think Canadians should be reassured that we have systems in place to detect safety signals and then analyze them. As I've said in my opening remarks, it's actually been quite a remarkable feat of international collaboration and science to try and sort out the initial reports. And I think the change in advice has been because there is now more information and that was made available. And still, even if the events were rare, while things are being worked out, that's the balance of risk and benefit was sort of examined. And that was the position and the advice that Health Canada and the National Advisory Committee on Immunization had provided. Every medication or vaccine can come with rare side effects, which will not be picked up until many millions of people receive the vaccine. The initial clinical trial with tens of thousands will not pick up rare events. So I think the important thing, to emphasize to everyone is that we have systems and checks and balances in place. But please do remember that over the course of the administration of the vaccine to many millions of people in the world, if there should be any new signals, we will be communicating that after a thorough examination. But science will continue to evolve in this space. On those over 55 years of age and over, the balance of risk and benefit is such that, the impact of COVID is much more serious in the older age groups, and that's the concern. We have a rising third resurgence, and with an acceleration of cases, and with the serious outcomes in older populations, when compared to a relatively rare event. That's how NACI made its recommendation as well. And as Minister Anand and the Prime Minister stressed, we do also have a fundamental base of mRNA vaccine.
Bonjour, M. Trudeau, Louis Blouin, Radio-Canada. Tantôt, vous avez parlé du Québec où l'opération se déroule bien. En Ontario, ça va pas très bien. Et le premier ministre Ford dit, écoutez, ça nous prend plus de vaccins. On voit des interruptions dans l'opération de vaccination. Qu'est-ce que le gouvernement peut faire pour aider l'Ontario dans cette situation-là qui est difficile? Et qu'est-ce que les provinces peuvent faire de leur côté? Est-ce que ça prend un resserrement des mesures à ce moment-ci alors que le printemps revient? Est-ce qu'il n'y a pas un besoin de faire ça de leur côté?
D'abord, en tant que gouvernement fédéral, c'est à nous que ça revient de procurer les vaccins, les doses de vaccins, et c'est ce qu'on fait depuis bien des mois. On avait promis 6 millions de doses pour la fin mars. On est rendu à en avoir plus que 9 millions d'ici la fin de cette semaine. Donc, on est en train de livrer encore plus de vaccins que ce à quoi les provinces s'attendaient. Nous allons continuer d'être là pour les appuyer dans l'administration de ces doses là où ils en ont besoin. On va toujours être là pour travailler en équipe. Je pense que c'est ce à quoi les Canadiens s'attendent, que tout le monde reste concentré en position de leadership sur la livraison de vaccins et c'est exactement ce qu'on est en train de faire. Par rapport aux mesures sanitaires publiques, je pense que c'est important que chaque province continue de prendre ses propres décisions, mais on peut très clairement constater qu'il y a un sérieux danger ou une préoccupation avec ce troisième vague potentielle de nouveaux variants qui sont plus transmissibles et qui ont des impacts plus sérieux. Donc, nous allons être là en tant que gouvernement fédéral pour appuyer les provinces comme on est là pour appuyer la Colombie-Britannique, par exemple, qui vient juste d'amener un resserrement de 3 semaines pour essayer de contrer ces variants, en même temps que on sort de plus en plus de vaccins toutes les semaines.
Good morning, Prime Minister. Theresa Wright from the Canadian Press. Obviously, we're very preoccupied with vaccines today. What are you telling your children and other young people when they ask you, when will I get the vaccine?
Obviously, we know how important it is to protect the most vulnerable, and that's why our vaccine rollout has been focused on elderly Canadians, on people in remote or Indigenous communities, and of course on frontline health workers. But we're getting closer and closer to the point where we will start to vaccinate more and more Canadians. But the imperative is always keeping Canadians safe. Part of keeping everyone safe is making sure there are increasing percentages of the population vaccinated, because that's part of what allows us to be safer as a society. But in terms of vaccination of younger people, we know there is much data being collected right now. There are studies ongoing. And for the latest on that, I'm happy to turn it to the expert and ask Dr. Tam about what the latest is on when we might know about how and when kids might start getting vaccinated. Theresa. You're on mute, Theresa.
Okay, sorry. The clinical trials, as the Prime Minister said, is on a number of vaccines ongoing. So I think first of all, some of the trials started in the older kids, the youth, and then some of the younger population under the age of 12, some of the trials have only just started. So it's likely that we won't hear about the youth, the teenagers, until later on in the year, and then the younger kids beyond that. So sometimes clinical trials can go faster, particularly if the enrollment is fast. And if there's actual disease activity in wherever those clinical trials are done. So the timeline's a bit variable, but that's all I know at the moment.
Good afternoon, Prime Minister. Marika Walsh with the Globe and Mail. For well over a month now, you've been asked what you personally knew about the allegations against General Vance in 2018, but instead of answering that question, you've pivoted to say what your office knew. So I'm wondering if today you can clarify for Canadians what you personally knew about the allegations against General Vance, whether you knew about them in 2018.
No, we did not. We knew that my office knew there was allegations that were brought forward. We did not know the substance of those allegations until the Global News reporting.
Hi, Prime Minister Mercedes Stephenson with Global News. I want to follow up on Marika's question about what you specifically knew. I understand that nobody knew the substance of the allegations in 2018, but your office was aware that there were allegations made. We've asked your office what you knew about that. In the last 2 weeks, they just keep telling us that you have nothing to add. So I want to ask you very specifically today, Prime Minister, did you know about any allegations of any concerns of sexual misconduct, regardless of the content, in 2018 or before and when you extended General Vance's term and gave him a raise?
No.
So what did you know at the time?
Thank you. That concludes Prime Minister's time for... We'll now turn to questions for doctors and ministers. Thank you, Prime Minister.
What that means. If your office knew and used the term we, what does that mean?
We'll start on the phone with questions. Just in one moment, operator. Over to
Thank you. Merci. Should I go ahead?
Yes,
okay.
please.
Next question. Prochaine question. Catherine Lévesque, La Presse canadienne. À vous.
Oui, bonjour à vous tous. Ma question est pour Madame Anand. C'était sur AstraZeneca. Je me demandais, est-ce qu'on peut revoir le contrat étant donné la suspension là, pour les moins de 55 ans? Qu'est-ce qui va arriver avec les doses qui nous étaient promises étant donné que la population sera moins grande dorénavant pour recevoir ces doses? Merci.
Minister.
Allô? Bonjour. Merci pour la question. Nous avons un contrat pour 20 millions de doses d'AstraZeneca et nous allons recevoir 20 millions de doses d'AstraZeneca. Et aussi, nous avons un autre contrat, comme vous savez, pour 2 millions de doses d'AstraZeneca COVID-19 qui vont venir de le Serum Institute en India. Donc, ces 22 millions de doses d'AstraZeneca, ça c'est un vaccin qui a déjà l'approbation de Santé Canada. Donc, pour moi et pour mon département à SPAC, nous devons recevoir les vaccins que nous allons déjà acheter. Merci.
C'est Dr. Njoo. Peut-être je peux ajouter quelque chose. Je pense qu'avec le but vraiment de vacciner les Canadiens le plus rapidement possible, c'est sûr avec les provinces et territoires, les médecins hygiénistes en chef, avec leur déclaration, ils sont tous unifiés. Ils vont ajuster leur programme de vaccination parce qu'il y a beaucoup de personnes, je pense encore plus de 55 ans et plus, qui peuvent profiter de n'importe quel vaccin, incluant le vaccin d'AstraZeneca. Donc, je pense que c'est vraiment une question pour les provinces et territoires, mais ce que je comprends, ils vont ajuster leur programme de vaccination pour considérer les recommandations de CCNI. Merci.
Suivi?
Oui, donc j'en comprends que finalement, le contrat reste tel quel, on n'y touche pas, vous me direz si je me trompe. Peut-être pour vous, Dr. Njoo, je me demandais qu'est-ce qui va se passer avec ceux qui ont déjà reçu une première dose d'AstraZeneca et qui ont moins de 55 ans. Je me demandais qu'est-ce qu'on devrait faire pour eux? Est-ce qu'ils devraient se tourner vers un autre vaccin? Ou est-ce qu'on va attendre les conclusions de Santé Canada avant de leur administrer une deuxième dose? Si vous pouviez nous éclairer là-dessus, merci.
OK, mais merci pour la question. Si on parle vraiment d'une personne moins de 55 ans et qui a reçu un vaccin peut-être entre 4 et 20 jours, oui, c'est sûr, il faut surveiller pour les symptômes. On a déjà, j'ai constaté la liste des symptômes. Je ne vais pas répéter maux de tête et tout ça. Mais je pense peut-être que si je comprends bien votre question, peut-être il s'agit d'une la deuxième dose. Je pense que pour l'instant, avec un intervalle allongé jusqu'à 16 semaines, on continue à être informés par les données probantes, aussi l'information que Santé Canada et les autres organismes réglementaires et aussi de santé publique continuent à ramasser et analyser partout dans le monde. Et je pense que c'est quand le temps va arriver avec les meilleures données probantes à date, on va offrir comme il dit, le meilleur vaccin comme deuxième dose pour les personnes qui ont déjà reçu une première dose d'AstraZeneca. Est-ce que ça, c'est votre question?
Thank you. We'll now go to the next question from the next journalist. Operator.
Thank you. Merci. Next question, Tonda McCharles, Toronto Star. Line open.
Hi there, thanks. I wonder if Dr. Tam or Dr. Njoo or Minister Anand might be able to clarify a couple of things on the AstraZeneca piece for me. How many in that age group aged 18 to 55 have already received the AstraZeneca, given that Canada had already, as I understand it from the website, distributed about 500,000 to provinces? And I wonder, Minister Anand, do you have a cancellation and get a refund on any portion of the AstraZeneca if it turns out that there's such a hesitancy about receiving it, or if it's narrowed so much now only is recommended between the 55 and 65-year-old age group, as I understand it, because you prefer Pfizer, Moderna for the older group?
It's Dr. Njoo. Maybe you can start sort of following up on what I think I said yesterday, based on the data that was provided, and I'm aware of. I think somewhat a bit over 300,000 doses have actually been administered of the AstraZeneca vaccine, or in this case, the one from the Serum Institute of India. I'm not sure. Maybe Dr. Tam has additional comments, but that's my understanding. That's somewhere in the neighborhood of slightly over 300,000 doses administered. Thank you.
Yes, just to add, I think it's around 307 to 309,000 doses, but many of the provinces have been using them in the over 655. So Ontario, for example, have not been using this vaccine. They continue to address the priority populations with the AstraZeneca vaccine. There was a couple of jurisdictions who may have used the AstraZeneca vaccine in the under 55s, but I think actually the vast majority of provinces were still targeting the older age groups. And so I can't tell you exactly, but just to emphasize that we have not received any reports of those rare thrombosis event with low platelets to date.
Minister Anand?
We are receiving 1.5 million AstraZeneca doses from the United States today as part of our contract with AstraZeneca for 20 million doses. And this is an approved vaccine in this country. As the Prime Minister has repeatedly said, any vaccine that has been approved is safe and effective and is the one that Canadians should take. And as a result, we will continue to bring in vaccines to this country following on from the approval of Health Canada for those vaccines, whether it's AstraZeneca, Pfizer, Moderna, or Johnson & Johnson. Thank you.
Follow-up question, Tonda?
Yeah, thanks. So I take that as a no to the cancellation refund business. 31 million Canadians is the estimate of the population over 18 that are supposed to be vaccinated with all the approved vaccines. So let's assume that most of those will be 2-dose vaccines, because we don't have a schedule on Johnson & Johnson yet. So that's 62 million doses. Can you give us an update? When do you expect 62 million doses to have been delivered on Canadian soil? What is the schedule also for Johnson & Johnson?
Well, just to refer to your comment before you ask the question, I wouldn't assume that, Tonda. I have said that the terms of our contracts are covered by confidentiality clauses, and I won't be breaching our contracts while we're trying to procure vaccines. Now on to the question regarding the number of doses. My team can provide the precise breakdown in the numbers of doses, but as I mentioned, we expect 44 million doses of approved vaccine coming into this country at least prior to the end of June. And we are still finalizing the delivery schedule with J&J, but we have had discussions with them, including some correspondence that I was engaged in last evening, and our deliveries of J&J will be beginning at the end of April.
Thank you. Next question, operator.
Thank you. Merci. Next question, Mike Lecouteur, Global News. Line open.
Thanks for taking our questions. I just wanted to address this to Dr. Tam and maybe Minister Hajdu as well, and Dr. Njoo can weigh in if you'd like. But like it or not, you've got a bit of a PR nightmare on your hands now with vaccine hesitancy because of AstraZeneca. At one point, the recommendation was not for over 65, then it was. Now it's for not people under 55. Besides just saying, just trust us, what are you going to try and do now or what do you have to say to Canadians who might try and avoid AstraZeneca at all costs?
I don't know, Minister Hajdu's on the phone, but I could start. Maybe I would do that. And I think just to reassure Canadians that all along the way, the recommendations were informed by the data at hand. So for those who over 65, it was just that there wasn't enough data as soon as the data came in, that the AstraZeneca vaccine was very effective in the prevention of illness and serious outcomes in that group. That didn't really come out through clinical trials. Those clinical trials didn't have enough people, but pointed towards that it would be effective. When the UK information and from other countries came in, the recommendation was rapidly shifted so that the vaccine was then recommended for the older age group. And that's based on data that showed good effectiveness. So that's, I think, what everybody needs to remember. This, again, is new data, and it's a precautionary approach for a rare event, but serious. So that is what the recommendation was based on. So I think fundamentally, the important thing is that, especially with safety signals, we want to be transparent and rest assured to all Canadians that the systems are in place and that the vaccines that will be going out for those for whom they're indicated will be safe and effective for those populations. So I think that's really, really key. I think, as the Prime Minister said, the provinces have come down to a consensus position. So when they offer the vaccine locally to you as an individual, those policies have already put in place so that you take whatever you have given to you when you make that clinic appointment. That's the important thing. But it's because we have a rigorous system to essentially analyze that data and put out the recommendations. Yes, this is a rapidly moving pandemic, and the vaccines are put in place, after very good clinical trials. But we will obviously continue to see data evolve. But that it's only to make sure that we have the best and most safe and effective vaccines for Canadians. That's why the recommendations are changing. So I think vaccine confidence is important. So, of course, there needs to be more targeted approaches to different population groups. I know that seniors and those who are at very high risk of severe outcomes have been rolling up their sleeves. We've seen them keep coming to get the vaccine. And certainly up to now, the provinces have been using up the AstraZeneca vaccine that they were planning anyways in terms of implementation. And they're just going to start changing their operational stance so that they can deliver the vaccine to the target populations. So I think, again, for Canadians, when the provinces offer you the vaccine, take the vaccine that you're provided.
It's Dr. Njoo. I could maybe add to what Dr. Tam said. I think I understand the question, and certainly we understand that for the average Canadian, there are obviously, I think, a lot of questions and concerns. And I think when the chief medical officers of health met, obviously on a bit of an emergency basis on the weekend, as we discussed this issue, it was top of mind as well in terms of how would this affect the vaccine confidence, or the flip side of vaccine hesitancy. And I think at the end of the day, what's really important and key is that it's good communication and being transparent and open, and that's what I think is very important moving forward. So the chief medical officers of health agreed that they, as the spokespersons as well in their individual provinces and territories, have a key role to play, and certainly giving credible information on a daily basis to the residents of the province, I think, is very important, so that their residents can feel comfortable and confident that the information they're getting from their public health leaders is good, and they should be following, hopefully, the recommendations from their public health officials. Another key group that also needs to be engaged are the healthcare providers, because we know that the average Canadian actually trusts their healthcare provider in terms of getting credible information. And so one of the things that we're doing is working very closely with the frontline healthcare providers, making sure that they're empowered, they have the tools, they have the credible information that they can then use to have informed discussions with their patients, so that at the end of the day, all Canadians can make an informed decision in terms of the best choice, what they should be doing. Which obviously we want to keep encouraging Canadians. Take the first vaccine that's offered to you. Obviously, all of the approved vaccines in Canada have been approved by Health Canada as being safe and effective. Thank you.
Thank you. I'll now turn to the room for questions. Just as a note that we've got about 10 minutes left, so we'll aim for brief answers with equal questions. Thank you.
Bonjour, la question est pour le docteur Njoo. On apprend que le vaccin d'AstraZeneca va changer de nom. Est-ce que ce changement de nom va s'appliquer ici au Canada? Là, je pense que le nouveau nom, c'est Vaxzevria. Excusez mon latin. Est-ce que ça va s'appliquer ici, ce changement de nom? Est-ce que vous pensez que ça peut aider à rebâtir la confiance du public, ou en tout cas lutter contre l'hésitation à se faire vacciner?
Ça, c'est une nouvelle pour moi. Je suis pas au courant avec, comme vous avez constaté, un changement de nom du vaccin. Peut-être la ministre Anand est plus au courant que moi. Pour moi, c'est comme j'avais déjà dit, que c'est pas un changement de nom pour renforcer la confiance dans les vaccins pour les Canadiens, les Canadiennes. C'est vraiment, je pense, que l'information crédible, comme ouverte et transparente des autorités, les autorités de santé publique dans toutes les provinces et territoires, aussi à l'échelle fédérale, aussi avec les fournisseurs de soins de santé sur le terrain. Donc, pour moi, je pense qu'il y a plusieurs moyens qu'on peut utiliser pour renforcer la confiance dans les vaccins pour les Canadiens et Canadiennes. Et pour moi, personnellement, je pense seulement un changement de nom. C'est pas grand-chose. C'est tous les autres moyens qui sont plus importants. Peut-être je peux laisser céder la parole à la ministre Anand ou peut-être Dr. Tam aussi. Merci.
Hi, it's Patty Hajdu. Can you hear me now?
Yes, Minister.
Okay. Well, I just wanted to go back to the last question, actually, and let people know on the issue of vaccine hesitancy. One of the announcements we made in February was a $64 million fund called the Immunization Partnership Fund, which is to support partnerships with organizations that work with a variety of different populations across Canada to help Canadians understand their choices around vaccination, to get better access to information in language that they understand best in their own first languages. And I think this is a really important part around working with folks that are worried or anxious about what vaccination might mean for them is to make sure that they have access to people that can communicate in ways that make them feel safe to ask those hard questions. And so I just wanted to kind of go back to that because I think this is an important piece. Not everybody will be able to get information in the same way. And at the federal government level, we know that there are many wonderful partners across the country working in a variety of different settings with a variety of different people that need to get information in different ways. And so this partnership fund actually supports their work and allows them to hire people and work in communities in a way that gets information to the folks that need it the most in perhaps different ways that we traditionally think people are getting information. Thank you.
Pour Madame Anand, vous avez parlé d'un début de livraison pour les vaccins de Johnson & Johnson d'ici la fin avril. Pouvez-vous nous préciser combien on pourrait en recevoir en avril ou en tout cas à quel rythme on va recevoir ces doses-là, peut-être au niveau des premières semaines? Je ne sais pas si vous avez une date précise aussi.
Oui, merci beaucoup. Je voudrais commencer par dire que j'ai été constamment en contact avec le fournisseur J&J pour l'implorer de fournir le calendrier de livraison définitive du Canada, y compris hier soir. L'entreprise nous a dit que le Canada devrait recevoir les premières livraisons au fin du mois d'avril, comme j'ai justement dit, mais c'est entendu des informations fournies actuellement. Nous allons vous donner plus de détails quand le Canada les reçoit. Merci beaucoup.
And did the government of Canada indemnify AstraZeneca and or Serum Institute of India for any potential litigation over adverse effects caused by their vaccine? And if so, has there been any discussion in recent weeks about potential liability to the government if, and we've seen cases of deaths in Europe that may or may not be related to the vaccine. I'm just wondering if that's something on your radar right now, a possible liability on this.
Okay, well, thank you for the question. I think you and I have discussed this issue in the past, and I have indicated that indemnification clauses are standard in vaccine contracts around the world, including in Canada's. In addition, we have been in the process of establishing a compensation regime that perhaps Minister Hajdu could speak to. But as it concerns the particular vaccine that you have mentioned, we are continuing to procure that vaccine as it continues to have the approval of Health Canada. Thank you.
All I can add to that is, yes, Canada is working on a vaccine injury program to support people that may become injured as a result of vaccinations. We are one of the last remaining G7 countries to have this in place, and in fact, it was a requirement by some of the manufacturers, and it is long overdue, and so we'll have more details as that work unfolds.
Hi, it's Tom Parry from CBC. Just a question for Dr. Tam. Doctor, I'm just wondering, the changing advice we're seeing on AstraZeneca, is this normal for a vaccine, or are we seeing this because of the fact that these vaccines were rolled out so quickly that the advice is changing as the real-world information is coming in?
Yeah, I think with other routine vaccines, things evolve in a slower track for sure. As you've seen, as what I've just said, is when the clinical trial data did not have enough, people over the age of 65, and then you get new information in real life that is actually effective. That's the evolving science. So I think I would say partly yes, because this is a fast-moving pandemic, but we are actually getting the real-world data faster than usual as well. So so having the information from the United Kingdom, for example, on this AstraZeneca vaccine, that probably wouldn't have happened that fast in routine vaccinations, but it did occur pretty quickly, and therefore the recommendation was changed. Rare adverse events even for routine vaccines will come up once many more millions of people get vaccinated, and partly maybe because the vaccines have been ramping up really fast. As the numbers of people who are vaccinated builds up quickly, you will then get these signals faster as well. So I think it's just a matter of the amount of vaccines being rolled out across the world quite quickly. But the process itself isn't different. I think the speed of which these signals or data is emerging is faster.
Hi there, Marika Walsh with the Globe and Mail. I have a second follow-up, but I'll make sure that my colleague Theresa, so I'll alternate. Dr. Anand, Minister Anand, I'm wondering if you can clarify specifically the timelines for vaccines now in Canada, because while you're announcing the speed up of deliveries of Pfizer, we have not yet, for example, received any information about the delivery of the core 20 million shots from AstraZeneca through that bilateral contract. So you're saying more than 40 million now by the end of June. Can you please just clarify what are included in that and what is happening with that main AstraZeneca contract for 20 million doses?
Sure, I would love to clarify it, and I'll give you some numbers broken down, and my team can reiterate them if you miss any of them, okay? So you know that we have 9.5 million doses coming into the country prior to the end of the week. And of that 9.5 million, we're going to be receiving 1.5 million from the United States. That 1.5 million is actually part of the 20 million AstraZeneca doses which Canada has purchased. So you have to consider that as the beginning of our deliveries of the 20 million. Okay, I was talking with AstraZeneca yesterday, in fact, about this and pressed them for the deliveries going forward in addition to the 1.5 million doses coming from the United States today. They confirmed that we will be receiving at least 1 million AstraZeneca doses in June under the APA. That's in addition to the 1.5 million doses coming from Serum and the 1.9 million AstraZeneca doses coming from COVAX. So if you put those AstraZeneca doses together with our Pfizer deliveries of 17.8 million and Moderna of 12.3 million prior to the end of June, you arrive at 44 million. Thank you.
Hello, this is Theresa Wright from the Canadian Press. My question is for Dr. Tam or Dr. Njoo. Most drugs and vaccines come with side effects, and some, like birth control pills, have a much higher risk of blood clots than the AstraZeneca vaccine. So why do you think that vaccine confidence in particular is so easily swayed by any reports of side effects when there are other vaccines and other medications that have greater side effects?
Yes, as you said, medications have side effects, and they're listed in the product monographs, and some of them, again, will change as more data comes in. So that's actually quite common for any treatment and medications. I think partly it's because vaccines are provided to people who are well, whereas treatments are generally provided to people who have a medical condition or who are sick. The birth control pill is actually quite an interesting analogy because that's also generally in people who are well but who have a particular need. So I think that there's partly is because it's a preventive measure, and so the bar is pretty high for the risk and benefits. But you're in the middle of a pandemic with people who are look at the death, hospitalizations, and ICU admissions every day. I think then it's important to point out in very real terms to everyone what that risk actually is, and explain that to the individuals as they are coming to get the vaccine. But yes, there's many different underlying drivers of vaccine hesitancy, some of which, of course, is related to misinformation. But I do think that the bar is set a bit differently for risk and benefit just because you are giving a preventive measure to a well person.
It's Marika Walsh again. I have another question for, I believe, Minister Anand. The shots coming from the United States this week, 1.5 million from AstraZeneca, have those gone through all of the Health Canada approvals, and will they be shipped out right away, or what do they still need to go through at Health Canada, and when will they actually be delivered to the provinces?
Maybe I can take that question. The doses from the Americans are under review right now by Health Canada. Each, as I've explained before in this forum, each vaccine is assessed on the data of the vaccine itself, but also data is assessed from manufacturing sites and indeed batch numbers. So those doses will be carefully scrutinized by Health Canada before they're released to provinces and territories for use.
So when will they be delivered then to provinces? What's the timeline?
It will depend on the data review done by Health Canada. Maybe Dr. Tam, you have more up-to-date information as I do, but my understanding is that they're still awaiting some of the information from the manufacturing site in particular. But that data, that information may be a couple days old, and I know Health Canada is working very closely with the corporation to make sure they have the appropriate information so that they can provide the regulatory approval for those doses.
I might just have something from the procurement standpoint after Theresa. Go ahead, Theresa.
I was just going to say we will have to check in with the regulator. I don't have any more information.
So from a procurement standpoint, the regulatory review of the additional manufacturing sites is to be completed in the coming days. That's what I was made aware of from the supplier late last week. But the procurement part of this is that the doses are being pre-positioned so that they're ready for distribution once the Health Canada approval has been obtained of all the necessary elements.
Thank you. That concludes today's press conference.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.